See if they need pericare. I almost bring the stuff with me and just assume they do. And I think if we return to giving good pericare before putting a Foley in, I bet our UTI rate would actually fall. Sorry, my pen's drape has seen better days. Zunk, zunk, zunk. By the way, when you come to take this test, you can repack this any way you want. So some kids don't like to put the gloves on top or whatever. So what I'm going to do is, hello, Mr. Wong, do you mind telling me your last name? Great, and so on. Do you have any allergies that you know? No? Okay, not the shellfish, not anything? Great. The doctor has requested that we put a tube in your bladder, and so I'm here to do that. It is not painful. You don't have to do anything, but just lie there. Your mouth open, no. Okay, so men get to be a lot more covered up, all right, because you don't need to see, they can be warm and all that kind of stuff. They just have their plastic legs together. No. So I'm doing that. I'm washing my hands, all that. Take this off. Have something available for trash. I've gathered my supplies out. This, okay. Doing the edge. Plastic side down. I could decide to place this. Because he's plastic, it's not going to work that great, so I'm just going to leave it here and I'll adjust it later on. Gloves. Outer cuff. Inner cuff. Oh, you know what the other thing students do that's a mistake? Is this. As they come over like this. Yeah, you need to come up between your waist and under your chin. All right, so this is sterile in the center. I kind of try to do that. So I'm just putting some drapes here, sir, just to keep everything clean. So on. All right, and Surgilube, already lubed. Check my balloon. Okay, how is my balloon doing? Is it leaking water? Nope, good. I'm going to leave it intact. By the way, let me just show you how this really works. This should rip. Of course, this is the skills lab, so it doesn't rip. But anyway, I'm trying not to touch the end of this fully, and I want to try to keep it protected in the box. I'm gonna get it all gucky. I know you like the technical talk. Okay, here we go. So I put this here because I'm not gonna put that in his bladder. All right, I'm on the wrong side of the bed, so I'm gonna do this with my left hand. Okay, so you're gonna feel me touching you, and it's gonna feel a little bit cold. Round. 1, 2. Yes, here we through that is a freeway, but most people don't do that either. And then boom. All right, so it's going to feel cold. I can do that. All right. So I'm going to have you take a slow, deep breath for me. You're going to feel me putting a tube in your bladder. So I start to put the tube in your bladder. If I hit his prostate or he goes, oh, or anything like that, I'm out, right? Because I don't want to cause bleeding or any kind of problem. Otherwise, normally that's not a problem. And with men, it's a lot, their urethras are a lot longer. You may have to go all the way up. I've had to go all the way up to the pigtail, believe it or not. Once I see urine in the bag, I go a little bit further. I don't want to inflate the balloon in their urethra and cause any problems. Now I hold it so it doesn't go anywhere, all right? And I hold on to the pigtail. That's just me, because my experience is if you let go of it, it's going to slide out. All right, so I inflate it. Of course, I don't know where it is in Mr. Simman, so I could get water sprayed in my face right now. But no. All right, he doesn't feel this at all. He doesn't feel the water whatsoever. Something students sometimes ask me. Okay, now I pull it back. And I can get rid of all of that. All right, the tube's in your bladder. Everything's fine. And it could be that the hospital wants you to tape it to the leg. For a long time, our technique was ripping their body off. No, that we would actually flop their penises up and they would secure it up here so that because there was a thought that if you were pulling it down here, you might be actually tethering people in a sense and causing pressure on their bladder neck. So hang the bed. What do you think? Simple. Throw away all your stuff. And chart 16 French Foley placed on first attempt. That's another thing I would say, how many times you tried to do something. You're going to start an IV and it takes you 3 goes. You got to say that up front with a 5 cc normal saline balloon. Prompt return of clear yellow urine, specimen to the lab or whatever it is. Patient tolerated the procedure well. We'll continue to monitor for altered elimination, right? Take my stuff away. Put it in, bed down, covered up. He's happy, I'm happy, we're happy. I used to go to San Gabe and we were on a floor where people